Over 50% of all people today that are on Medicare have selected Medicare Advantage plans or are switching to an Advantage plan. Sadly, many who have made that decision are doing so for the wrong reasons. So in this video, I'm going to share with you my honest advice about Advantage plans so you're aware of the 7 wrong reasons and the 2 right reasons to choose an Advantage plan. Now, wrong reason number 1 would be this. This is someone that says, I'm healthy, I'm turning 65, or maybe now going on Medicare 67, and I am planning on staying that way. And just so you know, I hope that statement does describe you, and I do hope that you will stay healthy the rest of your life. But the truth is, as we age, our immune system begins to break down. We tend to have more health problems. And so really, the truth is, it's not a matter of if it's going to happen, but when it's going to happen. Let me just share with you some very common chronic conditions today that happen to people that are 65 and above: diabetes, osteoporosis, heart disease, kidney disease, Alzheimer's, dementia, arthritis, stroke, incontinence, COPD, and on we could go with chronic conditions. Now, the reality is this. They say that people 65 and above, that 95% of all people today, 65 and above, are going to have at least one of these conditions. And almost 80% are going to have 2 of those conditions. So you may be healthy now, and I hope you stay that way, but the likelihood is something is going to happen with your health. All right, so we're making a decision at 65 or thereabouts that could impact us for the rest of our life, because we're making a decision based upon how we feel right now instead of wondering what could happen in the future. Now, I just want to close out this particular reason with the reality of cancer. Okay, cancer, of course, a terrible disease, but notice this: 60% of all people today that have cancer, in other words, they're undergoing cancer treatment and have had a cancer diagnosis right now, 60% of those are going to be 65 and above. In fact, for everyone that's diagnosed with cancer this year, 25% of those people will be between the ages of 65 and 74. High probability. I found this stat to be interesting. The median age for breast cancer right now is 61, and for prostate cancer, it's 65. So you can see cancer is impacting people that are Medicare eligible. So that is reason number 1, the wrong reason number 1, why you should not conclude that an Advantage plan is going to be good for you just because you're healthy and planning on staying that way. Reason number 2 would be this: agents oversell Medicare Advantage plans. What do I mean by that? I'm just saying to you that insurance agents oftentimes are going to promote Advantage plans. They oversell them by over-exaggerating some of the items about Advantage plans, and they typically do not talk about some of the disadvantages or the problems that occur with Advantage plans. And frankly, folks, the reason that agents oversell them is because they pay higher commissions. In fact, when someone enrolls into an Advantage plan versus a supplemental plan, that Advantage plan is going to pay the agent almost twice the commission, 2 times as much. So they really pay the agent a higher commission. But also what's interesting about this is when we write an Advantage plan, we literally get lifetime residual income. Okay, they pay for life. As long as someone keeps that plan, it's going to keep paying. Now, we compare that to a supplemental plan. Supplemental plans, again, are going to pay about half of what an Advantage plan pays in commission, and we get about 6 years worth of residual. I'll be frank with you. We don't make a lot of money off anyone. Insurance doesn't work that way. It's very much a volume type of a business. And so when an agent focuses on and really oversells Advantage plan, what are they trying to do? They're thinking only about their commission instead of, is this the right move for the client? Okay, and so we try to be motivated by first coverage. Yeah, we all make commissions. That's just the way the system works. But we have to start with coverage. What is really the most important thing to you? Not how much is that plan going to put in my bank account, but is that going to give you the coverage that you need? So again, wrong reason number 2 is because an agent oversells them. In fact, we find some agents, that's all they want to talk about. Why? Because they're concerned about their commission. All right, that brings us into wrong reason number 3, and that's this: because the Advantage plans have low or no monthly premiums. Watch this stat, folks. Right now, there's about 3,800 Advantage plans throughout the country. Now, by the way, 9 companies pretty much dominate the market. There's some regional carriers for sure. But of these 3,800, they say right now that for every 2 out of every 3 Advantage plan, there is a 0 premium paid to the insurance company for that plan. Now, we have to pay Medicare. This year, we have to pay $174.70 for our Medicare Part B premium. But usually the insurance company is not charging a premium. And so again, people are attracted to that. Now there are some that do have a low premium. There's I think right now the average when there is a premium is about $20 a month. But the point is they're relatively low as someone just looks at the monthly premium. And so sometimes that can be attractive. But again, just because it has a low or no monthly premium doesn't mean there's not going to be some additional out-of-pocket expense. And so again, when we compare that to a supplemental plan, we have to pay a premium because we've gotten rid of the risk or most of the risk that would be associated with any out-of-pocket expenses. When I have an Advantage plan, I didn't pay a premium, but the risk I take on will be the risk of my other healthcare services that I'm going to need on that particular plan. All right, so again, these are very attractive and again, promoted by agents because there's some people, all they're looking at is that monthly premium that's going to come because of the plan. They're not thinking about other expenses that could come if they have any kind of a health issue. That brings us then to the wrong reason number 4. And this has to do with the perks that are offered by the Advantage company. Now again, these are heavily pushed by agents. A lot of ads talk about these additional benefits called perks that are provided by the Advantage company that original Medicare does not cover. Perks would include gym membership. And so what happens is the Advantage plan will say they will cover a certain membership at a gym or maybe a YMCA or a community center. And if you go to that facility and you work out there, then they will actually cover that membership fee. There's a couple networks. One's called Silver Sneakers, one's called Silver and Fit, another is called Renew Active. So again, it's a benefit or a perk offered by the Advantage company. Now the reality is there's only about less than 5% of all people who have that benefit available actually use that. But again, it is a perk. Another perk that we have would be some type of a dental allowance. Now I'm careful, and I don't call this a dental plan because most dental plans are pretty thorough. A dental allowance means that the Advantage company will set aside maybe $1,000 or $1,500 a year, and as long as you go to one of their network dentists, then you actually can use that allowance. And sometimes there's dentists you can find that take it. Other times it can be difficult. But again, it's a perk, often advertised but highly underutilized. Also, the plans will do some type of a vision allowance. And they'll give you one eye exam a year at no cost, and then they also will give you some kind of a credit. It could be maybe $200 or $250 a year towards contact lenses or glasses. Something, again, that original Medicare didn't cover, but they're going to do. Also, we'll have hearing aid benefit. And again, this is a very much a legitimate benefit, hearing aids. So what they will do is they will set aside a type of hearing aids that they will cover, a network that you have to use, and then you'll have some kind of a very reasonable copay. And they usually allow you to get a hearing aid at a copay somewhere between maybe $400 to $700 a year per ear. So again, that's a legitimate one as well. A lot of the companies this year have what they call an over-the-counter perk. And they will give you some type of a credit towards maybe a card, maybe $50 to $75 a quarter, and you can go online or in their catalog and actually order things that you would just normally get over the counter. It could be supplements, could be aspirin, whatever, those kinds of things. And so you have an over-the-counter allowance. But my whole point is these kind of things are offered by original Medicare. So the Advantage companies oftentimes will talk about these and really promote these things because these are things that you wouldn't have if you stayed in original Medicare. Now, my advice is there's no problem with these perks, but we should never make a decision to enroll into an Advantage plan because of the perks. And so what happens many times is that people that are healthy, 65, hardly ever go to the doctor. They're very attracted to not only a zero premium, but also the perks that are going to be offered because they think, well, at least I can get something out of my plan. And again, I like the perks, but you should never make a decision about healthcare coverage just because they're going to offer these additional perks. There's a lot more to a healthcare coverage decision than that. All right, so that's wrong reason number 4. That brings us to wrong reason number 5, and that would be this peer pressure. Oddly enough, we see this all the time. Meaning what happens is when you're on Medicare, that's a pretty common discussion with other people that are also on Medicare. And you'll have a lot of people today, remember over 50% of all people today that are on Advantage plans, they've selected them. What happens is you feel this pressure because what do they talk about? They talk about, hey, I don't have to pay anything. You mean to tell me that you have a supplemental plan and you're having to pay $125, $135 a month for that? On my plan, I don't have to pay anything. Well, they still are paying something because they have to pay their Medicare Medicare Part B premium, but there's no cost, of course, for the plan, or a very low cost. They also talk about, hey, I get to go to the gym for free. Now you're paying for a membership. So the point is, peers will put pressure on you like you made a silly decision to decide to get a supplemental plan instead of taking this zero cost free plan. And because, again, the person who is promoting them has probably really never had to use the plan. That's what we typically find. They love them until they have to use them. But again, we have a lot of peer pressure that goes around, at the golf course, or maybe at dinner, or some kind of a social event with people on Advantage plans, and they make you feel like you're crazy because you're actually paying for a plan to get high quality insurance instead of a zero premium plan that has a bunch of perks. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, that brings us then to wrong reason number 6, and that is this: misconceptions, misunderstanding about switching plans. And the reason there is so much misunderstanding, misconception is, number one, agents don't really educate people about the rules for switching plans, but also because every year Medicare has this enrollment period called the annual enrollment period. And this is every year, October 15th through December the 7th. Okay? Now, what this is for, this would be for someone that is on an Advantage plan and they want to switch Advantage plans. So Advantage to Advantage. You can do this during the annual enrollment period, October 15th to December 7th, and we make that switch, then our new plan goes into effect January 1 of the next year. You can do that. There's no underwriting involved. If the plan's in your zip code, you can enroll during these 7 weeks, and it starts January 1. Now, we have a second enrollment period that's actually called the OEP, and this is, again, for Advantage to Advantage, and this is January 1 through March 31. Okay, same thing. I'm moving Advantage to Advantage. If I make that decision in January, they'll start my plan in February. If I make the switch in February, they'll start me in March. If I make the switch in March, they'll start me April the 1st. Okay, so again, we have these 3 months the first year, Advantage to Advantage. All right, and so that's the way it works when we're moving Advantage plans. But here is the tricky part. If someone is on an Advantage plan, and let's say they would like to move over to a supplemental plan, right? Now, it is true that these are the 2 times of the year we can do this. But what is not true is just because you want to do this doesn't mean you necessarily can do this. Because if I have been on my Advantage plan, let's say for a year or 2, 3, 4, 5 years, I've been on it for some length of time, and now I'd like to get out of the Advantage system and move over to a supplemental plan now, that will not be automatic. Just because I have these dates available to me to do it, the timing, but the issue will now be, now we have to go through medical underwriting, which means what? We have to submit a health application. We have to look at your medication. So there's this process. So we're going to ask you a minimum of 30 different health questions. We're going to check all your prescriptions you're taking now or have in the last 2 years, and we're probably going to need some kind of a statement from your doctor called an attending physician statement. And this information is submitted then to the insurance company, and now what happens is they do not have to approve you. And so the supplemental plan will look over things. If they find out that you have arthritis, they're going to deny your application. If you're an insulin-dependent diabetic and you're taking too much insulin, or you've had a complication such as retinopathy or neuropathy or a diabetic coma or an amputation, they're not going to approve your application. If you have spinal stenosis, you're going to be denied. If you're taking depression medication, some companies will deny you. If you've had cancer in the last 36 months, they're going to deny you. If you have AFib in your medical records, one incident AFib, you're going to be denied. You'll never get a supplemental plan. And so what happens is 45 of the 50 states, 45 of the states plus DC, in order to switch from a SUP to an Advantage, now we got to go through this process. The exception to that would be New York, Connecticut, Vermont, Maine, and Massachusetts. Those 5 states give a little bit more leniency from switching from Advantage to a SUP. But all the other states follow the federal guidelines and says this: you do not have to go through underwriting the first 6 months of when you start your Medicare Part B. So, quick example. I'm shooting this video today. It's July the 3rd, 2024. Now watch. If I started my Medicare this month, 7/1/2024, I have an A and I have a B date of 7/1/2024. Okay? What happens is when I first go on Medicare, there is this thing called a Medigap open enrollment period that's tied to my B date. And this B date switching lasts for 6 months. So what I can do is I can get any Medigap supplemental policy, anyone that's sold in my state, any policy that I would like to have during this 6-month window of my B date with no underwriting at all. During this 6-month window initially, and by the way, if you start at 65 or let's say you start at 67, whenever that B date begins, I have this 6-month window. I actually can apply 6 months in advance. And then once I hit my B date, I have 6 more months where I can get any supplemental plan that I want. I select the company and the plan, and there's no medical underwriting. The company has to cover my pre-existing conditions. They have to approve that policy. But after that 6 months is over, in all 45 of the 50 states and District of Columbia, now I'm going to have to go through that underwriting. Again, New York, Connecticut, Vermont, Maine, Massachusetts, not so. A little different rules there, but everywhere else, now I have to go through this medical underwriting process. So again, that 6 months is very key. So the 6 months in my example, if I had a B date of July 1, again, I can apply for a supplemental plan 6 months in advance. Now, it's not going to start until my B starts, but I can do it in advance. Most people do. But I still have 6 months after my B date. So in my example, that would be what? July, August, September, October, November, December, which means what? January 1, in my example, 2025, in 45 of the 50 states plus the District of Columbia, if I want to get a supplemental plan in the future, now I'm going to have to medically qualify to do that. All right. So there's a lot of confusion about switching plans. And so sure, it's easy to move Advantage to Advantage. No problem there. We got 2 times a year we can do that. But to move from an Advantage to a supplemental plan that you've been on for a year plus, now you've got to go through medical underwriting. So a lot of people have the idea, I'm healthy at 65, I like all the perks, I have a 0 premium, and when my health changes in 2, 3, 4, 5 years, then I'll switch to a supplemental plan and begin to pay a premium. Well, if that's going to happen, if that's your plan and you have a health change during that period of time, you're not going to get to switch that plan. Had a lady who was planning to do that, one of my clients just last year. And what happened was she stayed on the Advantage plan 5 years. She was going to switch at age 70. And literally 2 weeks before her appointment to come and see me, she was diagnosed with melanoma. And they removed it. She had to go through some treatments and all that. And she really is doing fine. But now to switch from Advantage to supplemental plan, she has to be cancer-free and treatment-free for 36 months. So again, she's going to have to wait 3 more years before she can attempt to do the switch. So someone's health could change, and then they can never get off that Advantage plan. They'd be on that plan really for the rest of their life. So we want to make sure you understand the rules for switching, because sometimes people make this decision not understanding how that works. All right, that's going to bring us then to the 7th final wrong reason, and then I'm going to give you 2 right reasons, by the way, but let's talk about this one first. And this one has to do with unaware of the problems that come with Advantage plans. So what I'm going to say to this is I am saying that there are some disadvantages to Advantage plan, and these are things that agents don't talk about. They don't want to disclose these, but these are critical for you to understand, okay? And so there are some problems with them. Number 1 is this, and that would be that now we have a private health insurance company that is replacing original Medicare for you. So that's why a lot of people even call Advantage plans replacement plans, because now you've come underneath the umbrella of a private health insurance company and all their rules, okay? When you're in original Medicare A and B, you're coming underneath the government's rules and the program that they have put together since 1965. And now we have a private health insurance company, and you'll see that some of those rules really are a disadvantage if you ever encounter the rule. All right, number 2, what happens with a private health insurance company when they put this Advantage plan together, they're going to have networks. Those networks are going to be either an HMO network or a PPO network. Now keep in mind, when you stay in A and B and get a supplemental plan, you don't have a network at all. We call it open access. You can go to any provider, any hospital, any doctor, any surgeon, as long as they take Medicare. You don't have a network with supplemental plans. But here they always will have a network. Just frankly, that's the only way that they can work. And so what they have is they have contracted hospitals, contracted doctors, people who have agreed to see patients on that particular plan. And what happens with these networks, is they change. Here, just recently, we're seeing several hospital groups just pulling out of the network. If you're on that Advantage plan and you want to go to a certain hospital, they're no longer in the network, so it's no longer an option. So these change on a regular basis, frankly. Now, one of the issues with the HMO network is you can't go out of your network. If that provider's not in the network, unless you're in an emergency situation, you have to go to providers that are only in the network. PPO will let you go out of the network, but the problem is it costs you about twice as much to do that. Co-pays go up, co-insurance goes up, max out-of-pocket goes up. So yes, PPOs give you the privilege, but again, it's very costly to go out of network on a PPO plan. Okay, and so we have issues, limited doctors, limited hospital choices, especially on the HMOs. And so again, a lot of agents don't talk about this. Why? Because they don't want you to realize there could be some restrictions. You may get diagnosed with cancer, want to go to a certain oncologist. Hey, these oncologists, they're not required to take an Advantage plan. It's totally voluntary. They can enroll in the original Medicare system. So if you have a supplemental plan, if they take original Medicare, they have to take your supplemental plan, but they do not have to take the Advantage. Number 3 would be this, out-of-pocket expenses. What do agents push? What do ads push? Well, they always talk about the zero premium, as though everything on the Advantage plan is going to be no cost to you. And that's not true. Now, number 1, you didn't pay a premium to the insurance company, but you still paid Medicare. The Medicare Part B premium this year is $174.70 unless you're high income and have a surcharge added to that. But the point is we're all paying to be enrolled in A and B. And so we don't pay the insurance company, but I can assure you this, you're not going to go to the hospital for free on an Advantage plan. That's going to cost you about $300 to $350 a day, up to maybe 5 or 6 or 7 days. You're not going to have an MRI or a CAT scan or a PET scan for free. It's going to probably cost you $250 or $300. You don't want to have cataract surgery or knee replacement for free. Those things are going to have, again, a copay with them. And so what happens with the Advantage plan, even though there's zero premium to be on the plan, you have a series of copays. They're very reasonable. They're not crazy high, but it's going to cost you for all the healthcare services that you're going to need up to a certain limit called the max out-of-pocket. Max out-of-pockets this year on HMOs are in the neighborhood of about $3,000 to maybe $5,000 for the year. PPOs are going to be somewhere between about $4,000 to maybe $7,000 a year. And that max out-of-pocket means you pay copay until you hit the max, and then you're done paying. And then those max out-of-pockets are reset every January, and then we're back to copay until we hit the max. All right? And so even though it looks like on the surface they're all free, they're not going to be free for sure because, again, we have copays up to the max out-of-pocket. All right, and then lastly, a very big deal, and I'll close with this about the wrong reasons, and that's a lot of people are unaware of this problem called the pre-authorization. And what a pre-authorization means this means that on the plan, your doctor only recommends. That's all they do. A doctor recommends you have a knee replacement, a hip replacement. Doctor recommends you need an MRI or a CAT scan. So a doctor makes a recommendation, but when you're on the Advantage plan, that doctor submits the request to the Advantage plan, and what happens, in order for you to get that scan or that knee or hip replacement or whatever service is recommended, that Advantage plan must agree with the doctor, must approve it, otherwise they're not going to cover it. All right, and so there's a whole issue with pre-authorizations. They say right now that about 70% of the services that people need on the Advantage plan will have to be pre-approved by the insurance company before that service is going to be covered. And sometimes they approve them immediately. Other times they delay coverage. They'll say, no, we want you to try medications, or we want you to try therapy, and then maybe we'll cover the hip replacement or something. Other times they just flat deny it. They don't agree with what the doctor's saying. Had a lady who needed a full hip replacement. Plan said, no, we'll pay for a rod only, and that's all she got. Okay, and so that's the pre-authorization process. So we're going to have this with the Advantage, and again, agents don't talk about this because this definitely is a negative because of the delays in coverage and denials that happen. If you have a supplemental plan, it never happens because the supplemental plan has no say-so. The doctor and Medicare make all the decisions. If doctor says you need it, Medicare says we'll cover it. End of story. You're going to get that knee or hip replacement or scan, whatever it is that you're going to need. All right, so the point is people are usually unaware of these problems because agents don't talk about them because these truly are disadvantages of Advantage plans. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, that brings us now to the right reasons, and there are some right reasons, okay? I think there's plenty of wrong reasons, and again, I don't want you to get trapped by making a decision because of those wrong reasons. But there are two right reasons for Advantage plans, so it certainly is a place for them. Okay, number one would be this. The first right reason and the main one would be just simply because of your budget. You may be in a situation where your budget is very tight. And again, you say, hey, I've got to have something that's low cost, and I know I've got to take on the expense and pay as I go, but that's all I can do. I just cannot barely afford even the Medicare Part B premium. And so when someone finds themselves in that position, I think they ought to get an Advantage plan. Why? Because they can't afford. Let's say they're going to get a G plan, and that G plan had a premium of $125 a month, right? Maybe they had an N plan, and that N plan is about $100 a month. And then they have to have a drug plan. And sometimes those are low cost, and sometimes they could be, $25 to $50. But my point is, if someone cannot afford that extra amount of money in their budget beyond paying for their Medicare B, then that's when they should get an Advantage plan. They can, and so I think there's a place for that. Or someone says, hey, I can afford that, but I'm not going to afford that. Well, if you're comfortable taking on the risk and to live within an Advantage system with, for the rest of your life, then go ahead and do that. So again, that's the right reason, just because it's too tight. Because what we find when people truly cannot afford this monthly additional expense, then they don't keep those plans. So it'd be better to go ahead and start off with that Advantage plan, find the best one you can in your particular market, hopefully a PPO, so you at least have out-of-network options, and you have a very good plan. But if it's not in the budget, please don't try to do it. So that's the right reason. The second reason that I think it's wise is if someone can get their medications to the VA and even some of their other healthcare services to the VA, then I think getting a supplemental plan is really a little bit too much insurance. Now, if a person doesn't like the VA system, then I wouldn't say that. But if someone says, I like the VA system, I've got good care there, I've got good coverage and it costs me anything, all that, then what I would do if I had that, if I can get my prescriptions to the VA, then what I would enroll in, it is what is called a Medicare Advantage only plan. In other words, it does not include prescription drug coverage because, again, I get my scripts at the VA probably at a better price. And so what happens here is now at least I have a civilian option. If I don't want to go to the VA, if I want to get a second opinion outside the VA system, now I have this Advantage plan that can provide that for me. Or if I'm on vacation, I had an emergency situation, or whatever happens, and now you have something for inpatient and outpatient. And again, we have some kind of a limit called a max out of pocket. So even if I had to go out, it's not going to break the bank. It gives me another option beyond VA. So I like that. Also, if you're TRICARE, which means this is people that are retired military. Not just that you served in the military, that would be VA benefits, but this means you're retired military. You have TRICARE, and what happens when you turn 65, it becomes TRICARE for life. And what TRICARE has agreed to do is they will coordinate TRICARE with A and B, or they'll coordinate with your Advantage plan. And one of the nice things about this here and this here, when you take that Advantage plan, you have TRICARE, it's not a permanent decision. If you don't like it, you can always just go back and have TRICARE only. But TRICARE will coordinate with the Advantage plan, and many times that Advantage plan will give you a Part B reduction. This year, we're seeing some of them $50 to $100 a month. They give a credit back on your Part B, so it reduces that, and that which increases, of course, your Social Security check. And so you have a wonderful plan. Again, we're going to recommend a PPO network in that kind of scenario as well. So those are two reasons I think it would be very wise at least to consider a Medicare Advantage only plan. Why? Because we have some other insurance options available to us, either VA or TRICARE. Okay, then lastly, I do want to mention there's some of you today that are covered by FEHB. You are civil service, FEHB, Federal Employee Health Benefits. And again, a lot of times people that have this will also look at an Advantage plan option because they can get their meds through the FEHB plan, and then they can sign up for a PPO plan and get all the perks that come along with that, and also a reduction in their Part B. So again, those are the scenarios. These three types of people who have other insurance options, and those that just simply cannot afford extra for a supplemental plan and a drug plan.